Hey guys, I just want to do a quick shout out to this week's episode sponsors. If you're like me, you're extremely busy. And I bet that if you're listening to this, not even watching it, you're extremely, extremely busy because you don't even have time to watch the full episode. And I get it. We're all busy. We're all trying to grind. Now, if you're also like me and you're looking for ways to stay healthy, I can't recommend Callow enough. Callow is a meal prep service here in Kuwait that has a wide variety of meals that fit a variety of different lifestyles and plans in terms of your macros and stuff. And what I really like about them is that you can customize what macros you can get in your meals through their app. Try them out. I can't recommend them enough. It tastes good, keeps you healthy, and helps with that busy, active lifestyle. Check them out. That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I am your host, Dr. Abdelaziz Al Khayyab. I don't know why I forgot my name for a second there. But it happens. With us is a very special guest. This is my current boss. If you guys remember, if you're OGs from episode 1, you'll remember that my boss in episode 1 was Dr. Mariam Kenawy. She was my assistant registrar in internal medicine. As time has gone on and I've developed as a trainee, now I'm in surgery. And this is my new boss, Dr. Mariam Kenawy. She's an assistant registrar at Amiri in general surgery. She is amazing. She is...
Thank you.
By the way, if anyone has a stereotype about surgeons, Mariam proves it absolutely wrong. Absolutely wrong. Dr. Mariam is extremely knowledgeable. I was really inspired by how confident she is on the wards, and I think she's the perfect person to come and speak about our topic today. As you guys might know, our topic is going to be about starting your medical career. Mm-hmm. Right? So obviously our target audience here at the Doctor's Brew are people who are just starting out, medical students, young doctors. If we appeal to everyone else, we're happy to. But today's episode, we're going to focus on how to start your career in medicine with a focus on surgery. So this is a world I know zero about. So if you guys are sending messages asking me, I know absolutely nothing. That's why we have Dr. Mariam with us.
Thank you.
Welcome to the show.
Thank you. Thank you so much for having me. So, a little bit about myself.
Yeah.
So, my name is Mariam Kenawy. I am from Egypt. I was born here and raised here in Kuwait. And I'm a cat mom. So I have 2 cats who I love so much. They mean a lot to me.
I have 3 dogs, 3 big dogs. So.
Oh, nice. Yeah. I love animals. I'm a big animal fan. But dogs to me are like high maintenance.
Oh, they're extremely
so I don't have the time for that.
One of my dogs, when he sees me, he doesn't bark. He just kind of goes, It's really weird. Sorry, I know it's a touch, and I had him during med school.
Oh, nice. That's a strong bond. Like, he's been here for the toughest times.
Yes.
I love that.
Yeah. I would have to wake up at 5 a.m. to make rounds at 7 because I drop him off at a babysitter.
Oh, that's nice.
Yeah. So, sorry, continue. You're a cat mom.
Yeah, I'm a cat mom. Love my cats. Sushi and Lucy. Okay, and...
love the names.
I love it. Yeah, I know. I adopted them they're adopted. They were abandoned in the street.
Nice.
Anyways,
I studied. Nice to them being abandoned. Nice to you adopting them. Sorry. Yeah.
And I studied in medicine, Kuwait University.
Kuwait University, and you graduated which year?
2019.
Okay.
Yeah.
And then, so where do you do your training in Kuwait?
So in the beginning, my training year, I did 1 year in Adan Hospital.
Okay.
Yeah, the reason I chose Adan at that time, first of all, it covers a huge area.
Yes.
So a lot of cases you get to see. And at that time, they had a trauma center, which we opened again in Adan.
Okay.
And because I love trauma, I was like, that is the best place. Like, there's a trauma center. I get to expose to trauma cases. So that's why I chose Adan, to be honest. Yeah.
Now, I want to get into the meat of this episode, but before that, we need to have a quick discussion of the second part of the Doctor's Brew.
Okay.
Sorry, the brew part, the coffee part.
Okay.
I apologize to our viewers. Today I'm drinking matcha, not coffee. I'm doing something
the betrayal.
Really a betrayal. This is a formal apology, but I will not apologize too much because it's absolutely delicious. It is from the Hub. For all of you Amiri Hospital people out there, you know the Hub.
We live there.
We live in the Hub. Hours of studying there. So they partnered up with us this season. So before talking about the hub, what do you think of the coffee?
It's really good.
Yeah?
It's really
Okay.
good. Like, it's a very smooth, not that bitter. I
Okay.
love coffee that's not that bitter. It's amazing.
Perfect.
Yeah.
And your coffee order is hot Americano.
Hot Americano.
Do you ever
yes.
have anything with milk or no?
Some, yeah, a latte, but I prefer like coconut milk or almond milk, not a regular.
What about oat?
I never tried it. I never tried oat milk.
really good.
Really?
Yeah.
Next
yeah.
time then.
What's it called? But yeah, so the just again, little shout out to the hub. Thank you for the coffee and thank you for the space for us to study. For anyone out there who is looking, especially medical students, young doctors, you're looking for a place to study, place to chill. The hub is a great place. I can't recommend it enough. It got me through a lot of my exam studying. So yeah, shout out to the hub. And yeah, and their matcha is amazing as well. So with that, let's transition into the first
Doctor's part.
part. Doctor's part, yeah. the more annoying part.
The more annoying.
So, okay. I want to know a little bit about your story with surgery.
Okay.
Yeah.
So let's see. Let's start with medicine. Why I got into med school, because that's like the number one question.
True.
That got me to surgery. So since I was a child, I knew I wanted surgery. I just knew it.
Really?
Yes, because I used to watch these. There was this animation movie. I know it's not a thing that people go like, oh, I watch Grey's Anatomy and that's why I got into medicine. I was like, no, I watched an animated movie that used to explain how the body works, the system inside, like the blood system when you have an infection, the heart, the cardiovascular system, the rest. It's called Once Upon a Time.
Okay.
It's actually a French animated series.
Wait, do you speak French?
No, I don't. But it wasn't translated in Arabic. But
Okay.
it's actually the base of it. It's
Okay.
actually a French animated series.
Very cool.
So when I watched that, I was like, wow, our body does that? That is awesome.
Yeah.
And to me, I was like, I want surgery because I want to see them with my own eyes, you know? I know this is sick, but...
No, it's okay. To contextualize my face right now, it's because when I still will not forget seeing necrotizing fasciitis during.
These are the
ACS.
worst. The one, no.
I couldn't. I actually went to the senior during it was ACS week.
Yeah.
And I went to the senior and I told him, I was like, why did you do this to me? I asked him like, what? You know I want psychiatry. Why do you do this? So it's amazing to me to see somebody else who's interested in that kind of anatomy and stuff.
Yeah.
So
So I was amazed. I was amazed by the anatomy, and I was like, you know what? Surgery is gonna allow me to see these organs, to see how things work. It's very interesting. So that's how I got into surgery. I was like, I always wanted surgery. It was my thing, Although I didn't know much about it, none of my family are in medicine. I'm like the first one who got into med school.
Oh, really?
Yeah, everyone advised me against it. But yeah.
Uh,
Now you know why. Now I understand why.
I plead the fifth. I'm not. Yeah.
But yeah, so that was very interesting. So I got into med school. I was like, I'm gonna learn more anatomy. I'm gonna learn the system. It's amazing. It's amazing. Even in school, I used to love biology. It was my thing. I really loved it. And med school, it was a bit tough. I'm not gonna lie. Med school is never easy.
A bit. It was. Yeah.
That's the thing. Like, people think it's gonna be a cruise like high school, which is a big no. Because we have this. We go into high school. We're always the top of our class. We ace exams and go like, that's just gonna be easy. So how hard is gonna be med school? And you go to med school, it's like, I'm struggling a bit here. And people need to know that it's not like high school. It is not like high school. It's completely different.
Yeah.
And it's fine when you struggle, because when it comes to people who are overachievers, and you see that a lot in those who go into med school, they don't accept struggle, because we don't struggle. We never struggled in high school.
Absolutely.
It was a breeze.
Absolutely.
So you need to go in a mind that you might struggle, and that's fine. It's not, you shouldn't be ashamed of it. It's a process. Everyone has their own journey through med school. You should accept it and go through it. So that's what I did. I did struggle through it, but you get through it.
Yeah.
Graduated. During my time, I was always interested, especially during my clinical years, when I was like, I went with an open mind a bit. I was like, maybe I'll change my interest. You never know.
Yeah.
I always enjoyed my surgical rotation. It was like a blast. I used to love it. Other rotations, not so much. And that's how I knew. Like,
see, I wanted to ask that because, one thing that I try to press on,
Yeah.
and people can't give me a straight answer, and I think there is an answer.
What?
how do you know it's surgery or not surgery? You know what I mean? I feel like there is every specialty has a personality type.
Okay.
And the type of thinking that is better suited to said specialty.
Okay.
Yeah.
So this is the thing. A lot of people say personality suits the career. I don't think it's a personality. It's not. You can't mold the personality. You can't mold the career itself. It's more of what are your interests? Like, for example, some people, they don't like quick things happening like surgery, you know? It's like, it's a quick thing,
Yes.
and you need to know, okay, is he for surgery or not? And you have to think on your feet, because every person who presents to you is completely different. For example, when you compare psychiatry, for example, you take your time to get to know the patient, you take your time to try to diagnose him.
Yes.
It's not a quick thing.
Because you have to hit those gray areas.
Exactly. So it depends on what you're into. Like for me, I love fast pace. I like, if you tell me slow pace, like, you know, internal medicine, I mean, I'm not dissing any.
No.
We shouldn't diss any specialty. Everything, we need all specialities.
Yeah.
But for me, I liked more fast pace. I liked more quick stuff. I liked thinking on your feet. You never know what you're gonna get. You never know what you're gonna happen in OT. Like, you're working in something and something happens and you have to think on your feet to solve it. That's what I was into. Trauma, for example, you never know what kind of trauma you're gonna get. You never know what kind of injury this patient's gonna have.
True.
That's my interest.
Now, but what about if we can hit on a bit of a gender topic here?
Okay. Oh, that's a big thing, man.
It's a
big
It's a
thing,
boys'
man.
club, right? Is it fair for me to say it's a boys' club? Or, I'm not saying.
I mean, look.
Amazing female surgeons, but it's a club.
Is it more of a male field? Yes, it is.
Yes.
We're not gonna say no. I mean, you see.
Yeah. Statistics-wise, I'm not talking about.
I'm talking about statistics. Like, you're working more with male doctors than female surgeons.
Absolutely. Yes.
Now the thing is, look, even when I was a student, people used to tell me, you know, surgery, even doctors used to tell us, you know, your surgery as a female, you know, that's kind of tough. You have a family to take care of. You have, I don't know what to take care of. So it's like a cultural thing. Like, oh, I'm a female. I'm a
female. I can't go into surgery because I need to raise a family.
Yeah, exactly.
Like, let's put it quite bluntly.
Yeah, exactly.
Yeah.
That's it. And like, on calls and I don't know what, and my husband or my family won't
And
let
not
me
to
stay
mention,
in the
like,
hospital.
You're dealing with a male, and you know what I mean? Like,
Yeah.
When, how can I put it? I've heard that you need to fight. This is what I've heard.
You have to
I don't know if this is true or not.
Not fight. More of like, you have to be firm. Like, this is what we need to do and this is what we need to get. You know, like, because people will, and I don't know how to put it, like, they will try to argue with you a bit. I'm not saying you fight like, oh, you don't understand anything. I know, not that.
There's
but
a way to be respectful.
Yeah, you have to be respectful, but at the same time, you're firm. You have to show them, okay, I'm the doctor here. I know what I'm doing, and I know what decisions I need to take and what's best for the patient. You're here to, whether to decide to do it or not, I'm going to present the case to you, and if you have any questions, you can ask me, but you don't argue or you don't tell me what to do, what's best for him, because you're not in that field, you know.
So what would you say because I know there are a lot of women out there, you know, medical students, young doctors that are discouraged to go into surgery because of this, and I would argue that we need to have more female representation. If it's more male representation instead of field, there needs to be more female. Just like how ethnically, we talked about this on a previous episode, how, for example, like a lot of textbooks are based off of white males, if I'm not mistaken, examinations wise. So that's why it's important to have diversity.
Yeah.
So what would you say to the girls out there that are the little girls in high school thinking I want to be a surgeon, then they become women and they're discouraged. They're like, oh, I can't be a surgeon because of my because I'm a woman, flatly.
Yeah. Well, I was told not to go into medicine from the beginning since I was like in high school because of that. Oh, it's a long process. You're gonna have a family. You're gonna get married. How are you gonna take care of them? How do blah blah blah. Yeah, but I stuck to it because I wanted it and I knew this is gonna make me happy, and I used to tell them, but this is what's gonna make me happy. Okay, now we're regretting it, but that's a story for another day. But you know, like, I really wanted it, although everyone advised me against it. And I was like, you know what, let me do it. it's my experience, it's your experience at the end of the day. No one can tell you what to do and what not to do. They can advise you, but they cannot prevent you from doing something,
Yes.
And that's how I went. I got into med school like that. I was like telling them, you know what, I want medicine, and this is my life, my experience. I'm gonna have to work in a career that I choose for the rest of my life. So I get to choose. I chose medicine. During the process, everyone told me surgery, no, and I was like, you know what? It's what makes me happy. I find my happiness in surgery.
Yeah.
So do what makes you happy. Don't let people put you down because of your gender. Don't let people put you down because they don't believe in you. You have to believe in yourself, and you have to find something that makes you happy and just go for it.
I love that. I love that because it's a shame if anyone, this is, I guess, the male privilege in me. I would hate to think anyone telling me you shouldn't do this because you're a man.
Yeah, exactly. Yep.
I don't know a single thing that I've never been in that position in my life where I was like, I want to do this career. They're like, wait, but you're a guy. You can't do that.
Yeah.
You know what I mean?
I get it.
Yeah, so I really hope there's some people out there that are listening to this and taking from your words. Hey guys, I just wanted to shout out this season sponsor, Service Hero. Service Hero is an application and website based here in Kuwait, and what it allows people to do is to rate the businesses and services in Kuwait and in Dubai for whatever reason. So you can show some love, show some areas of improvement. In this way, kind of a win-win for both sides. The businesses can improve, and also the customer can kind of voice their opinion. This also extends to hospitals theme. So if you've gone to a private hospital, private clinic, and you want to show your love, be sure to rate them and take another step further. The coffee you're drinking right now with this episode, take a photo of it, rate it on Service Hero, and let us know what you think. Now, I want to go back to what you said about personality type, because I would disagree with you.
Okay.
I think that, so do you know about the Myers-Briggs personality type indicator?
I heard about it. I heard about it.
So it's, again, it's very contested, and this is my psych brain coming in. There's a lot of, people say yes, no, blah, blah. Anyways, a lot of people use it for choosing careers.
Okay.
Because certain careers are suited more for this, for that. So I do think personality plays some sort of a role.
Okay.
But what I'm wondering is, okay, let's assume personality doesn't play anything for surgery. But what do you think are the traits someone needs to have, the soft skill side of things, to be able to be a good surgeon? So, for example, I would argue that if you're the type of person that doesn't if you like patient interaction and you want to have long patient interaction.
That's more of a medicine, psych, This is the thing. Look, for, let's say traits, things that interest you is fast track, basically.
Okay. So that's the main thing.
Yeah, for me, this is my opinion, of course. Everyone's opinion is different, but for me, surgery is like a fast track thing.
Yeah.
It's a quick diagnosis, quick management, and on to the next, and that's what I like people who like high turnover.
Sure.
People who like long interaction, like you said, it's more of a psych, because I was considering psychiatry at some point.
Really?
I loved psychiatry. I love psychiatry. I love psychology. But the only issue that got me I'm going to go into surgery is that it's a long...
The speed.
Yeah, it's long interactions, talking. I'm an introvert. I don't like talking much, So it's if you force me to talk a lot, I'm going to go I need a break.
After this episode, Mariam is going to go home and just sit and stare at the wall and be like, oh my God, this guy wouldn't shut up.
So that to me was I don't think I would fit much in psychiatry because this is not my thing.
Sure.
I need fast track, short interactions. Not short, you have to take full history and everything.
Okay.
But high turnover basically. So that's what I'm into. That's the trait I think that's more for surgery. ER, the same thing.
Okay.
Yeah.
Now, what would you warn as the downsides or warnings of this specialty?
Burnout. I think the rate of burnout in surgery is high.
Yeah.
Because the rate of the on-calls, and also because your patient, I don't know, I cannot compare in other places.
Yeah.
We'll just talk about my experience here, because your patient is your patient, so you're gonna have to follow him whether you're off on your off day or you're on day. whether it's on the phone, they
Yeah.
call you, they update you, and you see that all the consultants and the specialists, they always get updates on their patients, even if it's their off day, you know. I think that's a cause of burnout. It's like you're working the whole time.
100%.
The whole time you're working, you know. And I remember before they applied the ACS, which is a blessing. You don't know what life was before ACS.
Really?
This is a blessing. Okay.
Can you just tell us what's ACS for those who don't know?
So ACS is short for acute care surgery.
Yes.
Okay. So now there is a team that covers a whole week where they just see the emergency cases and they admit them and follow them for a week.
Right.
Back then, before that, we used to have on-calls for the team every fourth day.
Right.
And you had to stay with the patient and you finish the case the next day. So if you still have pending cases for OT, you stay and you finish these old cases. So and you have evening rounds post-call. So basically, I start my on-call. I finish the next day, for example, 7 a.m., but I still have cases in the OT. So I have to finish the OT cases. And then I have to you assign people every post-call to do evening rounds at 6 p.m. And if a patient crashes or whatever, you have to stay with the patient. Okay. So you go home by 11 p.m. That's like 2 days of your and you have 1 day off, and then back to on-call. So
you know, one thing I do want to comment about this. Isn't this dangerous? I'm worried how in the long run for medicine as a whole, we keep playing with our sleep schedules as if it's fine. Oh, we're just every fourth day you flip.
Yeah.
This is years of our life and our health.
Yeah.
This makes us prone to errors. I don't know. I know there needs to be people at night. But don't you think that there's a better way?
Well, that's the thing. It's easier said than done. Because you can't leave a hospital or a patient unattended by a doctor. So you have to have someone at night. Yeah. How can we make it better? I'm not very, I don't know much about it. Yeah. But you have to have a team. I mean, the system that we're applying now, where you don't do much, it's not a 24-hour on-call, it's less hours.
Yeah.
That is better.
Yeah.
The burnout is less now. I'm seeing, I'm not as burnt out as I used to when it was every fourth on-call. And you can see that in the whole department. Yeah. So I think cutting the hours, making teams, cover morning shift, cover night shift for I don't know how long, and then shift back. I think it's better than making them stay for long hours of no sleep.
Yeah, I was just, I've reflected on this a lot because this year, one thing that I've learned after trainee year is how much playing with my sleep. Yeah. I'm genuinely concerned about my health, really. Yeah. Because you look at these studies and the effects, and you're just a friend of mine, Bassam al-Mulla, Dr. Bassam al-Mulla, he came on the podcast. He was saying I feel like every on call I do is like a year off my life because I'm just messing up my sleep that much. You know what I mean? I don't know. Something I would like to actually look into, because I feel like medicine is heading towards more, kind of effective means of handling that. Now, back to surgery. Let's take you back in time. Okay. To when you were a medical student.
Oh, God.
So you wanted surgery.
I wanted surgery, yes.
What did you do to kind of put your path, your life in the
surgical pathway?
The path, exactly.
So, I found my interest in surgery, especially when I was doing my clinical years. So I was like, you know what? Let me invest more. So I went for electives, a couple of electives in different specialties. Not only general surgery. General surgery was my clinical rotation. Fine. Now I want to know what kind of surgery am I into. Yeah. So I went for electives in different subspecialties, hepatobiliary, thoracic surgery. I tried different things. I did elective in internal medicine just to see if I'm okay with medicine or not, just before I decide, you know? Yeah. And you have to go there, try different specialties, see what you like, see their lifestyle. Does this suit you? Are you interested in it or not? The second thing that you need to, after you decide, okay, I'm into surgery, fine. Maybe this subspecialty, plus minus, we don't know. You can't decide early, fine. Now you need to go more into research. Okay. Around that field, for example. You can do research in anything you want. Yeah. for example, because you want psych, you don't have to do research about psych. But it's better to understand your field better is to go into these things, you know?
Of course.
So that's what I did. I went into, okay, let's do research in surgery, for example. We started with case reports. So a couple, when I was a trainee year, we had 2 interesting cases at Adan Hospital that we actually did a case report about and we published them.
Oh,
with Dr.
okay.
Yeah, Dr. Khalil. I love Dr. Khalil. Shout out to Dr. Khalil. You know, he's amazing. He was an amazing mentor, and I really respect him. And we're actually doing another paper that we're trying to write. It's a cross-sectional study now, which is has a better weight than a case report.
Yes.
You know, you always try to target papers that have more weight, which is, you know, randomized controlled trials,
Systematic
case
review.
control, systematic review, you know, more than case report. But case report is not a bad start to start with, you know. So that's what I did, to be honest.
Okay. So first of all, electives.
Yeah.
Diversifying.
Yeah.
Trying out.
Yeah.
Blah blah.
And it doesn't have to be abroad. People always think elective has to be abroad.
Right.
It does not have to.
Okay.
You can do it here. You can do it abroad. You can do it wherever you want. But just pick a specialty and see it.
Sure.
And actually invest. It's not an elective where you just go like, hey, what's up, guys? And then you leave and you call it an elective. Actually invest in it. Actually go for the rounds. Actually take patients and present them. Actually do their on-calls if they have on-calls. You know, like be in the system with them to understand it better.
Makes sense.
Yeah.
And then the other thing you got into is research.
Yeah.
What about the practical skill side of things? Is there anything as a medical student that you could be doing? You know,
there are a lot of things. You have places where they give you suturing skills. I think Dasman was one of them.
Okay.
They give you suturing skills. You have Sharjah. They give courses there to learn how to suture, basic suturing skills, basically.
Yeah.
You can do that anywhere. You can also watch a YouTube, get a small surgical kit and just do it. It's all about practice, you know. It's, for me, skills are easy to get. You need to work more on your knowledge.
Okay,
That's
interesting.
the thing, because you can teach any monkey a trick.
Yeah.
A new trick, it's fine.
Yeah.
But the knowledge has to be there, because you need to know when to operate and when not to operate.
So now here's a point that I'd like to raise up to you about knowledge. I would argue that the medical curriculum for medical school, for exams like step 1, step 2, they're very surgery light.
Yeah, that's true.
If
That
I
is
have
true.
to sum up at least my impression of step 2, how I felt most of the surgery,
It's mainly medicine, internal medicine.
and mainly as long as it basically vitally unstable, laparotomy.
Yeah.
Vitally unstable, OT.
Yeah.
You know, but the what surgery, the type of sutures, blah 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 blah. This is not too much in the curriculum. Would you agree with that?
That is true. That's
Okay.
true. Like when you see these exams, it's basically, as you said, it's very basic surgery and more internal medicine. That is true. But I cannot comment much about it because I'm not an educator. I don't know what's the concept behind it.
Sure.
Is it? I mean, if you think about it, you know, I think internal medicine is the basics of everything.
Yes.
Like even if you're a surgeon and you're in the medical ward, patient has tachycardia, patient I don't know what, it's more internal medicine. So I think that's the basic knowledge that you need to get, is to know how to manage patient medically first, and then I think the surgically will just, you know, maybe if you read about surgery as an interest on its own, you'll be able to manage. But everyone needs to know internal medicine.
So that's what I'm wondering for medical students going into medicine. Okay, like they're going to medical school.
Yeah.
Okay, I want to go into surgery. One thing that I remember talking about during a lot of times during like medical school was kind of how a lot of students would go, for example, let's say their surgery rotation, orthopedic surgery, and then they tell you all these details about this surgery and this.
Yeah.
Super interesting, awesome. But at the time, you're just stressed about passing your exam.
Yeah. Yeah.
So would you argue it's a waste of time to be looking into all the surgery knowledge and blah blah blah, when in the end you're studying for an exam and this is not going to come up? Your exam is going to focus more on medicine.
Yeah.
You know?
So this is a very good point, because let's see, as a medical student, we tend to focus a lot on exams,
Yes.
and that's because I think the system pressures you that your value is the exam,
Yes.
and you need to know only what's coming in the exam. They don't say that, but you have to focus on what's coming in the exam.
Absolutely.
In my opinion, my humble opinion, of course, I think medicine is an ocean. So I don't see why don't you know more about surgery or read about these specific surgeries. It's for you. It's for your own knowledge. This is why I think it's very stressful for medical students. They can't split between, oh, I need to study for the exam, or do I need to study for my career?
Yes, absolutely.
You know?
Yes.
They're two separate things. So medical students tend to focus more on exam studying, which is not wrong, but you need to study for your career too. You need to invest in a career. Like, if you're interested in a specific topic, read more about it. It doesn't have to come in the exam, but it's for you.
Yeah.
You know, you just know about it. Even if on your free time, you don't have to memorize it by heart, and just read about it if you're interested about it. Why not?
Okay.
What do you have to lose? You know.
You know, I'd agree with that. Although for me, I did struggle in medical school because
We all did. Oh.
I wanted psychiatry, right?
Yeah.
But what do I believe is something core to being a good psychiatrist? Good psychological knowledge.
Yeah.
Okay. And I always wanted to do classes in psychology,
Yeah.
blah, blah, blah. But of course, that I was in med school.
You don't have that luxury, unfortunately.
Exactly. So I had to do a bit of outside reading and
Yeah.
stuff like that. But I did consciously realize how much I had to sacrifice from reading about psychology and that kind of stuff. Because I was like, well, guess what? That's not going to come in your exam.
Yeah, this is the thing. You have to separate that.
Yeah.
You know, like you have to think, okay, I'm going to study this for my exam, but I'm going to read this because I'm interested in it.
Yeah.
I don't want to know more about it. It's not easy. Again,
No.
easier said than done. Oh my God, so much easier said than done. But at least try. Give it a try, you know?
And what about, I remember a very vivid memory of my first surgery that I ever attended. It was a laparoscopic, I don't know. I'm going to be honest.
It's laparoscopic something.
It was something. It was red and there was blood. It was, okay? I'm not going to lie here, okay? Before I went into the surgery, I was in the little doctor's office and I remember I had my iPad.
No, the studying during rounds, like, oh my God, I have to know that in case they ask me.
Yeah.
I have to study that because my exam is like in 2 weeks, but they're not giving us a day off. Yes.
But I was looking at, okay, so I'm about to go to this surgery. And I kept staring at my iPad like, what do I do now? I didn't know what to look up. Like, what am I going to, like, small intestine, look up. So, I didn't know. I really didn't know how to go into this because, like we said, our curriculum is not exactly tied to this, right?
Yeah.
If you're going into, let's say, a COPD clinic, I'll read up on COPD.
Yeah, and you know what you're getting yourself into, yeah.
Yeah. When they tell you, like, read up on this surgery, what do you mean? Because, like, the whole thing is foreign. It's like gibberish. We look up scar, and you're like, huh? So what is your advice for medical students about to go and sit in on a surgery?
Look, I was an annoying student and during my clinical years. So, and I used to get very hyper during my surgical rotation. So I would go in the OT and, oh, what is that? What is that? So what kind of surgery is this? You know, you don't have to be that annoying, but you ask them. So it's fine. If they're in a good mood, you can ask them, do you mind me? If they're in a good mood.
I just want to start. Hold on. If they're in a good mood, because if you catch them and they're post-call and they're doing...
If they're not good at mood, just leave the room, you know?
Just slowly back away. Okay.
You know, you can get to ask them. I mean, there's no harm in asking. Ask the surgeon, oh, so what is this case and why you're doing that and why are you doing now? And and when they're like, if they tell you the surgery, for example, and what case it is, you can look it up. Okay, so indications for this surgery is what? Blah, 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 blah. Okay, they said this. What is this? And when do we operate? So you look on... for this disease, so when do you do that? It's not gonna, I mean, you're not gonna understand everything as a medical student, that's true, but you can ask. You have doctors around you, you read about it, and you need to go and discuss it with someone. Like, if someone is interested to give you some of their time, you can go. Like OPD, for example, you come and you sit in the OPD, for example, shadowing a doctor in between cases. Oh, I read about this and that. When do you do this? When do you do that? Why do you do this? You know, I used to do that.
Okay, so I think that's a good mentality for someone who's going in to think about.
And it applies to any case, any specialty, I mean.
Right. And now, okay, what about what do you think about the whole thing of medical students are essentially retractors? Like they just hold their what do you think about that?
Human retractor.
Because, I'll be honest, like, so one thing that I've heard from people, for a lot of people who even just, you know, they just consider surgery, they get put off because you're sitting there on your feet for 4 hours.
Yeah, being a human retractor.
Yeah, and you're just like, and then you think, is this gonna be my life? And then they go away from surgery. So do you think this is good or a bad thing?
You have to, I mean, you have to understand when you're a student or even as a trainee or like at some point you're just going to be a retractor because again, do you know what you're doing? No, exactly. So you need to see a lot to know what you're doing. That's when also like a lot of time I was a retractor, just you just retract and you just keep looking, but don't zone off. Like actually look and see what they're doing and ask in the process, oh, why are you tying? Why are you tying this vessel? Like X vessel. Okay, why are you doing that? Why are you doing this? You have to ask during. You're not just there to hold a retractor. You're allowed to ask. You're allowed to tell them, do you mind if I do this? If they see you can do it. If they see no, خلاص, you back off. You know, like, but actually you have to see a lot of surgeries to be able to do surgeries.
Okay.
You know?
Well, then what I'm also getting the vibe from a little bit here is that you also kind of do need some good mentors for surgery.
Of course.
It's not one of those things that you can just kind of go on your own.
Of course, you have to have a good mentor. That's why, like, you need to know who to ask. Like, if someone, that's why I said, if someone is there who is willing to get to, you know, sit with you and actually mentor you through it, that will be great to have someone like that, and you stick to him like a leech, you know.
Any tips on how to detect those people for, again, incoming medical students?
Oh, my way was annoy everyone and see who sticks. You know, like ask everyone, and you will see from how they're answering or how they're giving you, looking at you, answering you. Some people, they don't have the interest, and you back off. You're like, you know what? I don't think he's interested in teaching me. Not teaching me. Maybe he has other stuff to do. You never know. He has a lot of stuff in his mind. He's too busy, you know. So you just, because again, it's a big team. There will be someone out there to teach you, and the best mentors are usually the residents.
Oh, okay.
Because
that's a
they're
good tip.
students themselves in their boards, and they're fresh, and they will be willing to teach. So I've
known medicine very much juniors. Again, theme of this podcast: juniors helping juniors.
Exactly.
They like teaching because they're also excited. Like I remember when I was in internal medicine, there were some med students, and I got super excited. I was like, "Come here, let me teach you some stuff."
It's like you get too excited. It's like these are new things I'm gonna teach you. You know?
I finally know how to teach you something. I'm not useless. Okay, so another question about medical school. Okay, do you think that it's good from surgery wise? Okay, a lot of people will tell you, oh, from day one of med school, you should know. I want surgery. I don't want surgery.
No, come on.
So keep your options open, huh?
Yes, you have to keep your options open. You go in with an open mind and invest and put your heart in all the rotations and see what you actually, which specialty you enjoyed. Like for me, it was psychiatry or surgery, and I never thought I would like psychiatry. Although I do love psychology, and I was like, but
you picked two opposites there.
I know, I did. But it was like I loved my psychiatry rotation, and I was considering it. So you have to go in an open mind. You never know, because there's a lot of people who go in wanting something, and then they come out, they completely change their specialty and change their career because they fell in love with something else.
But you know, okay, here's one question though. What if you go and you do a rotation, and because most of the time, this is the story I hear from people who know, for example, they want to do medicine, they want to do surgery. They're like, I did my elective in this, and I left, and I was like, wow, this is what I want to do for the rest of my life. What about people that go, and there's a lot of things they hated, there's a lot of things they liked, and they're still like confused? What do you do then? Because I feel like that was a lot of my impression. Sometimes I'd go and I'd be like, I'm not, you know.
You're in between.
And you're just always worried you're gonna make the wrong choice. And I feel like with surgery especially, it's such an investment, you know, because you're really like, I feel like some of the specialties where you're making such a huge change would be psych, surgery, internal medicine. You pick one of these three things. You know, if you go into psych, you're not going to be medicine, you're not going to be surgery. If you're going to medicine, you're not going to be surgery, you're not going to be psych.
Okay.
You know? So what I'm wondering is, what about the people that go into surgery and they kind of feel, I liked it, but I didn't like it. I'm in the middle. What do you advise for them?
Well, you don't have to make a decision now as a medical student at all. I mean, try your rotations, and then you will see in your trainee year, because you're going to go do these rotations again, but now you're going to actually be working in these rotations.
Right.
And you're going to be more involved in them.
And working is very different too.
It's very different, completely different.
This is a very good segue into what should junior doctors do. So new graduates from med school, how should they approach their career of like?
So basically,
surgery,
again, when you're in a trainee, as a trainee, every rotation you're put on, please invest in it.
Okay.
Actually invest in it and go all out, you know, do your best. Whether you like it or not, you will know at the end, so you know what to choose.
Sure.
For example, خلاص, you set for surgery. You're set for surgery. You choose surgery. As a junior, if you're very interested, try once you're done with the word work, because as a junior, your job is the word.
Yes.
It's mainly the word.
Yes.
So you finish your job from the word, do the important things that needs to be done. And if there are like other things that are minor that can wait, you can ask permission from your senior. Do you mind, like, I have a couple of things that they're very minor, but the main things I did, do you mind if I come and scrub in with you guys? You know, and over there, maybe you will not do much. You will close skin, which is not a bad experience to learn how to suture skin. Some of the things that I used to do, I used to push anesthesia and tell them, hey, I want to intubate too. You know, like, yeah, like, because it's you are here to learn.
Yes.
So you get to go with anesthesia, learn how to intubate, put an IV line, put Follies, close the skin. You know, these minor skills, people look down on them as a junior, but they're very important.
I agree.
They're very basic and important. Minor OT, the minor surgery room, where it just cut wounds, abscesses, small abscesses. Very nice. You can get a lot of skills from that, so invest in that too. Why don't you go there if you're interested?
Sure.
But also, word comes first. Finish it. Ask your senior. If he's okay with it, then you get to go, you know?
Sure. Now, different question. What about trainees that are not interested in surgery? How should they approach their surgical rotation? What do you think?
This is the thing. I see, like, I wasn't interested in internal medicine and I wasn't interested in pediatrics much, but I put myself all out there. So it's not an excuse. Does not mean I'm not interested. That means I'm not going to do the job.
Yeah.
You have obligations. I know it's not interesting, but we all have obligations. My obligation is to take care of the patients. My obligation is to follow the patients. And I suggest, for example, why not, if you're following a case and this patient's going to OT and you're done with the word, go see your patient in OT, scrub in the OT. I know you're not interested, but try it, exactly. Why not try it? You know, you're not going to lose any, you're in the hospital anyways, so might as well do something, you know?
Yeah, I remember on one rotation, you know, I can see, you know, I see why sometimes the arguments, you know, some people say that, like, if they're not interested, sometimes they feel it's a waste because they have other priorities, blah, 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 blah. You know, to each their own.
Of course.
I remember once, I'm not going to mention which rotation this was at, but someone asked me, so are you interested in this specialty because I'm going to do X thing? And I said, I'm not interested, to be honest, but I'm here to learn.
Exactly.
You know? Do I think I'm absolutely perfect? I don't think so. But I think it's worth getting invested a little bit. Just also not to just be bored.
Exactly. I mean, it's, you never know. You learn things, and you never know when you're going to use them. It's not bad to learn new thing every day.
Yes.
It's completely. I mean,
true.
You should invest. Yeah.
Yeah, and now the next thing about, like, being a trainee and you know, surgery. The last thing that I kind of wanted to ask was, do you think that there's any core skills that, regardless of if I want to go into psychiatry, blah, 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 core surgical skills that you need that apply to everything? So, like, for example, internal medicine, I feel like maybe you don't want to go into medicine, but yeah, you need to know how to read an ECG.
Yeah.
You need to know how to handle desatting. Do you think the same applies for surgery?
Yeah. Yes, it's the same thing. As I said, internal medicine is the basics for everything.
Sure.
Whether you like it or not, it is. So you need to know how to read an ECG. Don't say, oh, I'm a surgeon, I don't read ECGs. No, you need to know how to read ECGs. Because you don't know, like if your patient desats, if your patient starts having chest pain, you need to know how to do that.
So what are the equivalent for surgery that apply everywhere
It's the
else?
same thing.
Oh, okay.
Same thing. You need to know how to handle cases in the ward where they start deteriorating, whether they're desaturating or not. You have to know how to read an ECG to be able to diagnose the case that you're having. You need to know how to do an ABG and interpret the ABG. You know, you need to know when to consult and when not to consult. There are things you can manage in the word, because we all study the same thing. We're all medical doctors. So the knowledge that you have is going to apply everywhere.
Yes.
It's the core for everything. Even in psychiatry, you have to rule out medical causes first before you diagnose them with something psychiatric. You know, it's the same thing.
Okay.
Yeah.
So I think this is something to remind ourselves as we're going into trainee year, like with going to our surgical rotations, et cetera, et cetera. I think it's something worth reminding ourselves that there are skills to pick up that we're going to use wherever.
Exactly.
Yeah. And
Exactly.
I mean, I'll be honest. Drains. I was not used to seeing drains.
Oh,
until
yeah, you can see a
surgery.
lot of drains in there.
So that was a fun experience. Not fun. Educational experience for me, because I
How
was
to
able
handle
to,
them, how to remove them.
Yeah, that kind of stuff.
Yeah.
And so to close off this episode, I want to ask for any medical student or junior doctor
Okay.
pursuing a career in surgery, advice and warnings.
Okay. Advice and warnings. Okay. So an advice is don't self-doubt, for example. We all have that at some level. And I think it becomes way more as a medical student, because the questions that you should know that, you should know that, you know, when you're doing your rotation. And
Yes, I do.
And it's like, dude, come on, I don't know it, then it's just, okay, I'll read about it, you know? That increases our self-doubt a lot. And I think don't give in your self-doubt that much. You know, you have to remind yourself you're only human. I know they're saying, when they tell you these things, they tell you this for, you know, for your benefit, like, oh, as in go read about it. Maybe their way of doing it is not that cool, because they don't know the psychological effect that it's having on us or on whoever they're telling.
Or they forgot because, you know.
Yeah, you know.
There's an element of, and I understand it, everybody went through this, so then you do the same thing.
Yeah, it's a repetitive thing. And they don't mean it. I don't think anyone is that evil, you know. They're just saying that just to encourage you to read it.
Yeah.
But don't give in into your self-doubt, and like try to believe in yourself. Try to believe in your training. I mean, if you made it that far, you are good enough. Don't let anyone tell you that you're not good enough, that you shouldn't be where you are right now. You earned it. You worked hard for it. So you need to believe in yourself, you know. It's an advice and a warning at the same time. Do not go into your self-doubt and believe that self-doubt. It's normal to have it from time to time, but it is not the core. It's not who you are.
I love that you're saying this, because I'll be honest with you, even for me the past few weeks, this has been an issue I've been having.
Yeah.
I've been coming home and I'm like, wow, what am I doing?
Exactly.
And I think the more that we're honest and saying that this is a shared feeling, it lightens it.
Exactly, because you see that a lot, especially like people walk in with confidence. Like sometimes you have to fake your confidence. This is how I did it, you know, like
all the time.
Like
all the time.
I am not a confident person. I had to fake it until I made it, you know. Like I'm not confident. I struggled with self-doubt a lot, especially when I was a medical student. Yeah.
Sorry, to contextualize for anyone watching, Mariam is so confident on the word. She goes in there, and if you tell me this is the youngest consultant, I'll be like, yeah, sure, I believe you, man. So.
No, I was not like that. But sometimes, like, I had a lot of self-doubt as a medical student, okay? And I had to believe in myself. And it's not, it's, again, easier said than done.
Absolutely.
But you have to self-talk, the self-talk that you have, instead of having the negative self-talk that says, I'm not good enough, I'm an idiot. You have to change that. You have to change that talk and go like, you know what? I am good enough. I made it that far. I know what I'm doing. And if I have a point and I have proof, like papers and stuff, then I know what I'm doing. And if anyone tells you, like, sometimes when I go head to head about a specific plan or how that, it's because I have proof.
Yeah.
I have research papers that I can send and prove that what's been said is true. You know, like, they always tend to make you feel like, not, they don't mean it, but we have this idea as junior doctors that we should just follow orders like
We're glorified secretaries.
Yes,
Yeah.
we're not glorified secretaries. We are doctors, just like anyone else. Okay, the rank differs because the experience differs.
Of course.
The
responsibility.
responsibilities
Yeah.
differs, of course. But you're still a doctor. If you think there's, you know, you want to discuss a specific issue about a patient or a case, speak up. I mean, it's not wrong to speak up. You can do it in a very polite way, but you can do it. You know, don't hold back and go like, you know what, they just asked for that. I don't agree. I don't know why they asked for it. I don't know why I'm asking for a CT, but you're doing it anyways. It's like, what's the point then? You're not learning anything. Discuss it. It's not bad to discuss it, you know? So yeah.
That reminds me of a story I'm going to tell you off the air.
Okay.
Sorry guys, this is some non-doctors stuff happening later. But I cannot tell you how much I appreciate hearing that.
Thank you. Thank
so
you.
For everybody, I know, listen, especially medical students, like, I remember at one point I really doubted myself in medical school because I would call my parents and I would say, was I secretly dumb and nobody told me? Seriously?
Oh, I've been there through that, yeah. And I was like, how did I make it that far?
Yeah.
How am I going to graduate and become a doctor? I don't know anything. I'm not that good. Are they letting me be a doctor? I think it's something wrong with them. So
it's absolutely true, like, just,
and it does reflect on you.
Yeah, but you know what? Fake it. Fake it. And
I used to freeze when people used to ask me in rounds. I will go blank. If they tell me, okay, differential of stroke, for example, I go like, I don't know. I don't know. And I will just stare there. Like, if you ask me alone, on my own, I'll list them for you.
Yeah.
You ask me, if a doctor, like a more senior, asks me, I'll go blank. Because I have
me during chart rounds.
Yes. Because this is, and I do see that a lot in chart rounds. I see that in rounds. And I know why. Because this person has self-doubt. He's not trusting himself and he doesn't believe in his training. That's why he's second guessing himself. And I've been in his shoes. I know what it feels like. And it's not easy to get out of it.
It's not. No, it's not.
And you just have, again, positive self-talk. You have to keep repeating to yourself, I am good enough and I'm learning and I know what I'm doing.
And if I could add on to that one thing.
Yeah.
One issue in medicine as a whole, and this is my critique of a sort of culture of medicine, where hierarchical.
Yeah, I know what you're trying to say.
Yes, there's rank.
Yeah.
Okay. And there is this feeling of, I don't want to look dumb to anyone above my rank.
And so you get more stressed.
You get more stressed, and then you're scared to, you know what, ask dumb questions. Like, for example, there was a lot of times, like in OT, why did I avoid going to OT? It's not because I wasn't interested. It's not because I wasn't
You're
free.
scared they ask you questions and you won't know how to
Nope,
answer.
not even that.
Uh-huh.
I forgot how to scrub it, and I'm scared to ask anyone.
Oh.
See? So, of course, this was during medical school, and I pushed through that.
Yeah.
Okay. But that's just an example of how I'm scared of looking bad.
Yeah.
Okay?
That is the worst thing.
Yeah. And I think, especially during trainee year, and I've found this even during my surgical rotation in internal medicine, don't be scared to
ask. Even if they go like, oh, it's a stupid question, khalas, just I know, just, you know,
it's fine.
Just tell me. Another trick I used to do, no, it's not a trick, but sometimes when I go like I'm too shy to ask, I just like YouTube it, you know, how to scrub it, and you just watch the video, just do it, like, oh, I know how to scrub it, I knew that. You know,
you shouldn't be scared of what they think. And I know it's scary because there's an evaluation. You feel like they hold your life in their hands. But life is so much bigger. Yeah. And
you're in a learning process.
And you know what? We sometimes over dramatize the things that happen to us. I'll give you an example recently from my life. I was chatting with my mom on the phone, and I was really stressed about something. And I was like, oh my God, this is stressing me, blah, 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 blah. And she stopped me and she just went, Aziz, you lost your dad. In the grand scheme of it, you've gone through something so much worse. I suddenly calmed down. Everybody has this in their life.
Yeah.
I'm using my example because
Yeah,
this
yeah.
was the big thing.
Yeah.
But everybody's gone through that thing.
You
where
underestimate yourself a lot.
and you're like, bro, chill. I can do this.
Yeah.
This is just what. This is not even a bump in my life. And again, easier said than done. I
Exactly.
struggle with it today.
Yeah, everyone struggles with it.
Yes.
I believe everyone struggles with it from day to day. It's just how much you're gonna believe in it.
Yeah.
That makes a difference, you know.
Absolutely. So I guys, listen to this motivational talk, and actually, you know what? If we could, guys, please find a way to add some motivational music to what me and Mariam just said, and then just loop it, and then go into the wards with that
I can
music.
do that. You can do it.
It's in black and white, and then it's just like, when you're tired, don't stop, keep hustling. I'm just kidding. Sorry. Anyways, thank you so much for being here.
Thank you for having me. Really,
Yeah.
I really enjoyed that. I thought it's actually pretty chill. I
It's
loved
chill, I
it.
told
I
you.
loved it.
It's not stressful. It's
yeah,
not
it's
stressful.
not. I went in. I was like, oh my god, I'm gonna look like an idiot.
No, see, self-doubt. There we go. Self-doubt. Guys, that's the last sip of coffee for the day. A final special thank you to our guest.
Thank you so much.
Thank you to our coffee partners, The Hub. Please, everybody, go drink coffee, take a photo, and if we sent you there, tag us or something, mention us. If you like what you see, like, comment, subscribe, all that good jazz, all that good stuff. Thanks again.
Thank you for having me.
Awesome. Perfect. Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.